Okay, we're starting now, Rikami, so you'll hear us
Today's COVID
introduce you and then
update
we'll get
is
started.
brought to you by Fulltech Systems, your technology
How do
center,
I pronounce your last
where
name?
you'll come for the price but stay for the
Okay, thank
service.
you. Back, and we're moving into our second conversation for today. Of course, our COVID 19 coverage includes perspectives from all across the globe. And today we're checking in with a well known Belizean. You guys may remember her from some of her poetry and the books that she wrote. Rita May Hyde Tala, who is a Belizean living in France. Good morning.
Good morning.
Good morning, greetings everybody, to all Belizeans as well who are listening in.
Yeah, looking gorgeous this morning, nice and bright. What time is it there?
Right now it's about 3:40 p.m.
Okay.
Okay.
So I'm in plain work mode. We are working and I can get a call at any minute. As a matter of fact, when we're finished here, I have a conference call.
Okay. Well, good afternoon to you then.
And good morning to everybody.
So, Rita May, we really wanted to be able to talk with people, especially Belizeans, to understand what it's like in their area as across the globe we're facing the pandemic. So let's talk about what's happening in France at the moment.
Well, the thing to know is that I wouldn't say we're all in the same boat, but as this is a pandemic, we're all affected. It's for the first time the world is experiencing something of this nature. There's a lot of fear. I'm always worried for what is happening with my family, with my friends, with everybody in Belize, because I know the vulnerability of our health system. But here in France, I can tell you that it's reassuring to know at least that the health system is trying to do its best in terms of this crisis. We have over, I think, 160,000 confirmed cases. It might seem like a lot, it's less than 60% of the population. But of course, there's been over 20,000 deaths. The thing about it is to keep at home, to follow all of the measures that are put in place by the government here. My work as well has a lot of measures in place for us as staff. So we've been working from home since the 16th of March. That is not easy work from home, as you imagine. Trying to do everything from a distance in online, organizing meetings online. It's very tough at the same time, worrying about this overall situation. Yeah. I'm in the last trimester of my pregnancy, so that's another added complication, but we are grateful. We're grateful to be happy and healthy during this very difficult time, and we're trying to do all that we can as a family, my family, to keep safe and to adhere to all the rules of the home country.
And of course, you said a lot just now, but let's just to break it down a little bit. You had mentioned part of what you were speaking about was following what it is that the government has put in place. Now, I'm sure you might know that for comparison's sake in Belize, that the entire country is under a state of emergency. They've restricted movements of people in several different ways. Some businesses cannot operate. Some people have to stay home. So in terms of the situation in France, what is it like? What is it that the government has actually put in place that people need to follow?
Well, the first thing also is the confinement, the lockdown. It's the mandatory lockdown. So, for example, people find it difficult, but for me, it's clear this measure that is important to keep us safe and keep others safe. For example, I know that in Belize there's the lockdown, but here you cannot leave your home without an attestation, without a written attestation. You have to print it, write it out, and in this attestation you have to say exactly what is your 5 categories, and you have to click if you're leaving your home because you're an essential worker, or is it because you need medical help, or are you going to do grocery shopping? But you have to communicate what is the reason to leave home and the time that you're leaving, because they don't want you to be on the outside for a long period of time. And it's very tricky. And once you adhere to that, there's a fine of over 100 euros. And I know they've fined so far thousands of people.
Yeah.
For
So
the
you're
large part, people are respecting the confinement.
Yeah. So when did you enter into this lockdown phase, this stringent lockdown phase?
We started on the 16th of March. So today's day 37. Like I said, it's not easy. Today's day 37. I keep reminding myself, telling myself daily that this will all pass, this too shall pass. And I have a countdown. I'm thinking, okay, they just announced that we will be out of the lockdown the 11th of May. So I'm literally counting down to the 11th of May.
But that's because your date kept on being pushed down further, right? To lift the lockdown. It was supposed to be earlier.
Well, it was not necessarily supposed to be earlier, but they said that we would have different days. So the first date was up until like April 15th, and then the President Macron came on and said it had to be extended to 11 May, but there was never an end date in mind. And even this 11th of May date that we have been given, it's not complete and a complete opening. It's going to be in different stages, not for everybody. So for example, on the 11th of May, some of the daycares will be open. Some schools will be open, but then they will have to, for schools, they will not be able to have more than 15 students in one class in order to respect the numbers, the social distancing, and all of that.
Okay.
It will happen in phases, so it's for everybody. I know that for my work, for example, they're telling us that we won't automatically go back to work on the 11th of May because we will have to see who are the people that we have to go to the office, because the less people are out there, we have less risk of having another phase of surge of contamination.
Yeah. So you're on day 37 of your lockdown. We're on day 10. So it's good to see that 37 days later, we still look as sane as you do right now.
Well, Barney, I can tell you that it comes with a lot of every day waking up and trying to be positive, making sure you get a little bit of exercise in, because it's not healthy mentally, physically, spiritually to be in confinement. But I think during these type of moments is when we can dig into our culture, dig into our values, dig into ourselves, because this is a moment that is very difficult for everybody, and we have to overcome it, and we have to think about community. So I call people all the time, and people call me all the time. So that kind of helped to cheer me up as well.
Now, looking at the cases in France, I understand that a lot of the casualties have been from elderly people in nursing homes. Is that the case? What's the main affected demographic, and what's the story coming out there?
Well, the majority of deaths are related to indeed elder people, and you have, I think it's about 70 or 75% of the cases, those that have died have been elder people. And it's a bit sad because you see that in this time, for example, we took my husband's grandmother, she's also living in Paris, and we took her from where she was living in her own, and we brought her with us. We wanted to make sure that she was healthy and well, somebody would be there to take care of her, which is not always the case with the older people. They're in homes, and the homes are seriously affected, and that's why they're asking people to stay away, like not to go around them too much, because they're more at risk for contamination with this virus. But yeah, majority of the cases that have resulted in death, this over 20,000 people, have been mostly older people.
Yeah. In the seriousness that people have, in Belize, we have our lockdown measures in place. You were saying before that that you have more stricter terms for your lockdown versus us. Um, One of the things, Rita May, because you've lived here, is that the healthcare system has not been up to par for a very long time, and it's something we know going into the pandemic. You're in a country where arguably your healthcare system will be far better than what we face here. What are your thoughts when you think of people back home, and whether how much we should be adhering to the recommendations that are being made?
Being here, I can tell you that when this thing first started here, at the time police didn't have any case. I was just thinking, oh my God, I hope that this does not go to Belize, because of those reasons you just signaled, that the healthcare system is not strong. There are many loopholes in it. And I was thinking, if a virus like this hits Belize and is not handled properly, it will be devastating for my country. So here, the measures, like you mentioned, are very strict. I follow what's happening on a daily basis, and I see that although not everybody is adhering to the measures of staying at home, social distancing, I think that majority of people are. Maybe I'm wrong, but from what I'm seeing on social media and when I'm looking at news, and I think that we need to continue to take this very seriously, knowing Belize is not at this couple of a massive surge in cases, confirmed cases, because we have all the equipment, we don't have ventilators, we don't have. So I think about Belizean daily. In particularly the essential workers. Even my sister Karen, she lives in San Pedro. She's working every day. She's out there as well. I think about my family, but most importantly, all the doctors and nurses and people who have to leave their homes to work, because it's not easy knowing that the health system is not prepared to deal with these people once they're coming.
You know what I think what your perspective really does bring to light is, I know that people want to think of this as kind of a short-term measure, but it is in fact going to be a lot longer if we look at examples everywhere else. So you went into lockdown on March 16th, but there were restrictions that were being made from before when you first started seeing cases.
Exactly. There were already measures in place, and there were already a lot of social media, a lot of news campaign. I remember receiving text messages from the government of France to my phone, and I was surprised. I'm like, how do they have my number? Of course, this is the 20th century. They have everybody's number. They have all your information, everything. But it was surprising to see that I was getting even these messages to be careful, to wash my hands. I mean, these things we take for granted that everybody does them, but that's not necessarily the case. So we definitely started, maybe not as early as we could have, but we started earlier enough. And 16 March, that's when the strict measures came in place. And most of us were thinking, okay, it's going to last maybe a month and a half or so. Now we find that it's going to be very gradual. It's going to go over a longer period of time than we had hoped for. This is important. It's important because unless it happens like this, the virus, the number of contamination cannot be stagnant. And even the health system at France, that is more developed, cannot handle such a surge in cases. As we've seen in recent days, sometimes you have 300, 400 deaths per day. That means that the health system is also suffering. It's not fully capable.
Absolutely. Now, Rita May, we wanted your experience from France, but you've also introduced, I think, another element that we haven't thought about. Women who are expecting and you have to go to the hospital to deliver your baby. What are your thoughts as you're wrapping up your third trimester?
Well, to be completely honest, in the beginning, I was very, I was worried. I was worried. It's normal to be worried because I said, what is happening with this virus, the way it is going? They probably would not let anybody in the hospital. Will I be alone? Will my husband be there with me? All these thoughts because births, it's such a great family occasion, a time to celebrate, and the idea of being alone, it was something that I thought seriously about, and then I said, okay, I have to prepare for the worst case scenario. But the good news is that the hospital contacted me and they told me that my husband will be up for the delivery. He will have to leave the hospital immediately after, as long as he does not have any symptoms of the coronavirus, because they test you on arrival, will be able to be here during the birth. It's not an ideal situation, but at least we have to be happy with what we can have during this very strange period that we're all going through at this time. We like to
Yeah. You know, I'm glad you pointed that out. I know at one point they wanted to not allow fathers to be there for birth, but that has been something that has changed. You're saying he has to be tested before he actually goes in, and he can only be there for the actual delivery.
Yes. As you enter the hospital, the rules are, even me, I have to be tested. Like you mentioned, I go and I do monthly checkups, and I have to do monthly, not only checkups with my doctor, but also monthly obligatory blood work here. They ask you to do all these different tests that we would normally do in Belize on a monthly basis. And each time I go, they have to test me. And then if I go to the hospital, they have to take my temperature, ask me if I have symptoms. Before they need to see my doctor. So it's a bit of a complicated process, but and you do understand that with the seriousness of this virus, there's no other option. You have to go along with these measures. If you want to be safe, you want to be safe.
Yeah, like I said, I didn't think of that particular perspective until you introduced it, but it's good. I mean, the precautions will be necessary, and it sounds like you have grown accustomed to it as you've done your monthly visits.
Do you think, no, I was going to ask if you think that if there's anything that us in Belize, or that we in Belize rather, that can learn from what's been happening in, or what you've done in France or in the rest of Europe. Do you think that there's any trends that, or particular thing that you're doing over there that we're not following yet that maybe we should be doing?
I think that in terms of the solidarity and the community, I know in Belize, when this thing happened, before they had the lockdown, I told my husband, I wish I was in Belize because that's where I have a community, that's where I feel connected, that's where I feel the most loved. This Belize is my country, and I would prefer to be there during this time. Unfortunately, because of work and everything, there was no way possible to have been in that time. But one thing I have realized is this community term still, even after all these years, is that people are very creative way to express that shows solidarity. At 8 p.m. every day, people go out on their balcony and shout and speak and laugh. Those people who are working, essential workers. And in the beginning, you thought, but that's not going to change the world. That's not going to do anything. But guess what? The third day, you felt good to just go on the balcony and scream with everybody. And shout with everybody and say, yeah, we're all in this mess together, but we will get through it together because human beings have always done that. Humanity has always overcome the greatest of adversity. So I think that spirit of community, in terms of expressing it more, I think it's there in Belize, but maybe if we find ways to express it, because it's for everyone to know that we're all in this together, no matter what. I know sometimes I see people chastising people on Facebook, you should be home, people are out on the street, but maybe if we turn it into a much more positive per se, let's see how we can support each other with all the positive positive energies and the just shouting and saying, yeah, we know you're out there. We appreciate what you're doing to keep us safe. I think that is something different.
Yeah. We have enjoyed seeing the videos come out from Europe of people applauding and making noise. I've also seen it in New York as well. Maybe we'll develop something, because we can be pretty loud here in Belize too,
Oh, yeah.
so we could take advantage of that. But what you said, I think, is most important, that even in a time when we're asked to keep a physical distance from each other, we can find ways to still build community, because we are still collectively in this experience together.
Exactly, and physical social distancing, as they're using the term, maybe, I don't know if it's a good term to use, but it's a physical distance, but you are still connected to everybody, even though it's not the same way that you would wish for. You have all the other ways of connecting, and I think it's good to reinforce these family bonds, these community bonds. Believe we have a lot of values at the place, and now is when we can rely on those things and let them flourish and work in this time to keep us.
All right. Any message out to your friends and family who I'm sure they're watching right now as we close off this segment?
I will switch to Krill for that message there.
Well, Lula, I'll be happy to hear that.
Yeah.
I know Lula is on. I can't see it. I can only see by screen. I can't see what's happening. Unfortunately, I will try to look at the segment after.
Yeah.
But I want everybody want to keep safe. Want to follow the rules. I love everybody. Love my family, my mom, Myrtle Hyde, all my sister friends. Like I said, I have family that are all over Belize. And want everybody to keep safe, and much most importantly, to all the essential workers, continue to do what you do and big up on yourself. And thank you, Marlene and Gavin for this opportunity.
Thank you
Thank you
too. It's great to see you. It's great to have your positive energy with us again, and best of luck with the last few weeks of your pregnancy, and please stay safe.
Thank you.
All
Bye-bye.
right. Bye. There you have it. So another perspective to add to the conversation, Belizean living in France, talking about what's happening there, day 37 of their lockdown.
I know, right? Really intense.
Sobering thought. We'll take a few moments to be able to digest that as we go to the break. But when we do come back, we're going to be talking about people with diverse abilities and their access to information and access to the needs that they have during this time. That's going to be the conversation after the break, so stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.